As COVID cases are on the rise, attention now turns to an uptick in flu cases. Over 1,200 hospitalizations nationwide associated with influenza, and in Massachusetts, nearly 3% of doctor visits are flu-related. That's higher than the last 3 years at this time. Western Mass News talked to a Bay State doctor about what's different this flu season.
It's still relatively low numbers compared to COVID-19, but it's increasing.
Bay State Health's Dr. Armando Paez tells Western Mass News their laboratory is reporting 69 cases of influenza from last week. The predominant strain this year, H3N2 and Type A. The State Department of Public Health reports Western Mass is on the lower end of the spectrum of flu activity right now, compared to the central and eastern parts of the state. The numbers are higher so far this year. We asked Dr. Paez why.
Number one, I think the masking plays a big role. I mean, last year, there was a mask mandate. I think everyone is more cognizant and maybe more careful in terms of going out and, wearing a mask, for example, in the community. Now it really depends on the risk and how people kind of behave.
And he says this year's flu vaccine is a factor.
It depends on how effective is the flu vaccine, how many have been vaccinated against the flu. I think it may play a role as well, in terms of how much flu we're going to get this season.
We asked, how do you know if you have the flu or COVID, since symptoms are very similar?
It's difficult to differentiate it clinically, because they have overlapping symptoms. But typically the flu will have an abrupt, onset of symptoms, commonly lasting 3 to 4 days. Usually it's an body aches. That's very common. And stuffy nose, as well as sore throat and headaches.
And there are some symptoms specific to COVID, he says, such as loss of taste and smell. But Dr. Paez says it is best to get tested for both viruses.
The mission is to get tested for COVID-19. At the same time, they can test it for flu, because if they're high risk for development of severe illness, particularly elderly and the younger population, they may benefit from treatment if it is caught early.
What age groups are getting sick? Well, Dr. Paez did not have specifics on this for our region. He says overall it is mostly younger people. And he has this advice about staying safe in the coming months.
The best way to do it is that if your child or anybody at home feels sick, don't go to school or work, depending on where you're going to be reporting back to work or school, because, it's only, of course, to protect your other people as well as take care of yourself.
The latest data out of the CDC shows flu infections are impacting the 5 to 24 age group. However, cases among those 25 and up are increasing.